The camera quality is not great, so I would like to be. It's okay if I don't clear it on. Sorry.
Yeah, of
That,
course, no issue.
it's all right.
Thank you. Thank you.
You can, well and good. If not, that's good too. Okay, so first of all, thank you so much for everyone who joined in. And I would like to introduce our very first guest of a brand new series between the Introns, Nivedita. So Nivedita is a certified genetic counselor from the American Board of Genetic Counselors, and she graduated magna cum laude from Washington State University with a minor in pre-genetic counseling. After which she took up a master's degree in genetic counseling from Case Western Reserve University, and currently she is pursuing a PhD in public health from SRM Institute, and she is also working as a senior genetic counselor at Newburgh Center for Genomic Medicine. Nivedita, we're very happy to have you here to talk about your journey as a genetic counselor.
Thank you. Thank you for that introduction, Sukriti. I think Sukriti and Mayuresh know me because we work together. So
Yes.
yeah, they know pretty much. But thank you for this introduction. It's very nice that you guys are putting this together for your prospective students who are already in the field and furthering our field, genetic counseling. So thank you for doing this and thank you for making time because I know you guys are also very busy people.
You're doing two things at once. I'm pretty sure you're very, very busy. So thank you for taking time out for this.
No problem. Yeah, all of us are. Yeah.
Yeah, but we are very glad so that you're getting to do this. And like you said, this is for prospective students so that they get to know your journey as a genetic counselor and they get to resonate with some parts and they get some inspiration to continue in the field. Uh, Thank you, Secretary, for the introduction. So, on behalf of the Indian Genetic Counseling Journal Club, I welcome you all. So, to begin with the interview, just before we begin with the questions, I'll have one uh, announcement that we are going to record this meeting and we are going to put up this video on YouTube. So participants who are comfortable with switching on their video can do that. And if you don't want your video to be on YouTube, you can switch it off. But we'll be asking few questions which we have here ready for Nivedita and also questions we have got from the audience. Towards the end, we will open the platform for people in the meeting to ask questions to Nivedita, and then you can have direct interaction with her. So, hi Nivedita, I welcome you again. Uh, so before we jump into the questions, I want you to introduce yourself to our audience and tell them whatever you want them to know in the beginning about you.
Okay. Well, I think most of my introduction has been done so far on LinkedIn and through you guys. But I currently work as a senior genetic counselor in Newburgh, and also pursuing my PhD in public health, specifically genetic medicine, which is kind of like interesting in our Indian context, which I have been trying to navigate through myself and try to make contacts within our field. But a little bit of background that is not on my CV is that I did my bachelor's in genetics as well, which you might already know, from Washington State University. Um, I just a little with that story, like I never knew about genetic counseling. I don't know how many of you knew about genetic counseling in your college or your undergrad or even before then. I didn't know. Like I went into genetics not knowing what to do exactly. And then it was very late. So, well into my third year of my undergrad is when I discovered this whole field existed. At that stage, even in the US, it seemed very new. And where I was, it was very difficult for me to find GCs who could talk to me about it. So, I kind of did this digging and deep dive. Maybe that made me like pushed me further into this profession because I had done so much work by then and too late to turn back maybe, but it all turned out well. And then it was just keep digging, and no, I did not want to take no for an answer at that point. So pretty much, that is how it all turned out, and I think it turned out good. More to come. I'm still digging, I guess, with my PhD and trying to do whatever I can and what more I can do. So that is pretty much a little bit of an introduction from my end. But I am excited for your questions, so that way I know what to answer and go from there.
Yes, thank you so much for telling us about what motivated you to take up genetic counseling. So, like you said, you did your bachelor's also in the US, and as we see in your CV, there was a minor component in your graduate undergrad itself for genetic counseling. So, apart from having that, what was certain experience or what was certain motivation that pushed you further more that okay, I should be pursuing genetic counseling as a career or doing a degree,
Right.
master's degree in it?
Master's degree. Okay. So, rather than what motivated me in a positive way, I found out things that I did not want to do. Maybe that is how most of our genetic counselors have been, and most of my class where I graduated with, we found that we knew we had like a passion for genetics or specifically medicine, life sciences. So all of us pursue that. But what I found that I did not want to do was a few different things. Considering a PhD at one point at that point, so it was more of benchtop, pipettes and flasks and all of that. I did experience that, so I worked in a lab for 2 years. And through that experience, I knew I was not a person who was going to sit there with my test tubes and mice and dissect and do that. I was craving for that people interaction, which I had, but I needed new people. I craved that feeling of learning new things from other people, interacting with them. Also, a selfish feeling of wanting to be needed, or like a sense that people need me, or I could help people if I'm out there, and I drew some joy from that. So that kind of feeling made me dig deeper as to what I wanted to do. So I knew benchtop research was not my thing, so that's one ruled out. Then obviously the other choice was, okay, should I go and do medicine, become a doctor? And that kind of also got a little difficult being in the US, and the challenges that faced. And also I funny enough that the I did have to do observations for that as well. And what happened is that the doctors there did not also have time enough that satisfied my need of like wanting to be there for my patients, right, wanting to be there for the people that I am with, and not having time because everyone was on a clock, right? You have 15 minutes to see your patients. Observed in a ER, and that itself was like they just roll through the doors, and I didn't feel like that was enough time to connect with the patients and enough time to get to know someone you're willing to help, and maybe through that change the course of their life. So I did some googling, and there were only few options left after that point. And one of them was genetic counseling. And I felt like that was a perfect interaction in like a Venn diagram where I interacted in the middle of science, people, skills, and also being part of the health system. So I kind of it was just like magic. It kind of fell together. So I kind of process of elimination rather than process of selection for me.
I think you have worded like these feeling is very common in a lot of genetic counselors that they don't want to do like bench work, so they eliminated options which they did not want, and then they
Yeah.
came across genetic counseling, which
Yeah.
was like you said, a people interaction, what was you were craving for, and
Yeah.
something that you're looking to pursue professionally, to serve in the healthcare system and to be there for your patients. Like you
Yes.
mentioned that there were a lot of challenges in the other options you were going through, like medicine or the PhD program you spoke about. But genetic counseling in the US is right from the application is a very stressful process.
Yes.
So, how did you go about that process, like selecting universities and applying to them and getting to know their prerequisites? So, how was that journey for you?
So as I said, I discovered genetic counseling very late. But the thing was, I had time in the sense that I finished my undergrad a little bit earlier, a semester earlier. And I had that time, and which I think all of us can get. You just take a break and then figure it out. But the whole process was, you are right, it is tedious, it is a long drawn process. It starts from how many universities are there. There's not unlimited, you've got so much. And then you choose the ones that you like, and then you choose the ones that, or you try to find out what they focus in, because most of these websites are very discrete, or they look exactly the same from one another, so you don't know the flavors that they can offer. um, so it's just a process of like communicating, trying to reach out to alumni, genetic counselors who might have graduated from there, reach out to them, see what's good, what's best, kind of make a Excel sheet, if you will. And I know all of you guys would be doing that, because that's how we are as genetic counselors. And you draw out like what is your top priority. There might be a piece of information that you learn that might put suddenly one other university over the thing that you thought was going to help. So one thing I would say is reaching out to alumni. They are usually very friendly people. They welcome questions. So that is one way. The other thing is, I don't know if this exists anymore, but there was a website which rated schools based on their programs. And I kind of blindly believed it. I kind of went along with it, because that they already made a list for me, and I just had to go down the list and do my research. I don't know if it exists anymore or it's even up to date, but there's only so much. There was like 10 that I decided that I wanted to apply to, and they were pretty much on there. And certain universities I did reach out to, certain universities I decided not to, because it was too expensive or had prerequisites that I did not have. So it's kind of like pick and choose, but like an educated guessing game at the end of it. Yeah.
Okay. Uh, yes, I think the pointed networking, and you said about alumni, that's like the
Hmm.
best thing to get information about university. One other thing that stands apart in the US, in the Western university, when we compare it to the Indian programs of genetic counseling, is that a lot of programs in the US or in Australia have an emphasis on volunteering experience, working in crisis helpline or hotline to get counseling exposure other than your like,
Right.
BSc or BS degree. So, how do you think that experience helps students during their degree and also when they become professionals?
I think it helps tremendously, honestly, because if you have to be a people person to be part of genetic counseling, and that is the only way you will know, by interacting and volunteering with people who are, I want to say, like in a place where they need you, and you know how to talk to people who are in need of your attention. You might learn through those experiences that you don't like people, which is completely fine. You don't have to like people. But through those experiences how you interact with them, if you find satisfaction with helping them. Because at the end of the day, right, it's not about, like, genetic counselors don't make that much money. So if you're in it for the money, I'm sorry, you're in the wrong place, right? It's about the job satisfaction. You're able to derive that pleasure from like helping people. And those interactions that you have, volunteering services, making sure that you're a people person. It is a validation for you from your end, that this is a field that you can survive for, maybe, hopefully the rest of your life. And also for your programs to know that, despite all the other things that you have going on, maintaining a high GPA, this and that, you did make time for that thing that makes you satisfied, derives your satisfaction, helping people. So that is what the programs want to see, and that is what you should know going into it, right? So pretty much I think that you have to do that. Even in programs here, you don't have that, you don't require that. But it's a good idea to have that. You can work with people, because majority of your life you're going to work with people, either in the clinic setting or in a lab setting, where you still deal with people who are in need of your services, are in need of your time, skill, whatever.
Yes, like you mentioned, yes, we are going to meet, interact with people, patients, and even like clinicians. So, like you said, we being a people's person and we being able to communicate with them is an important information for program when they like admit like very few students or they want to make the right choice. Um, so when you talk about interacting with people and professional, being a GC professional, you have to interact with people. So how was your experience at the Case Western University, and what were some of the factors that helped you to rank it top on your list?
Okay, Case Western was not on top of my list to start off with. Like it didn't start there. I knew I was going to apply there because it was one of like the well-known universities, and it was very good for its technical like base, like your genetic knowledge. It's very good for your base of that. I interviewed there just like anything else. And then it is kind of like your deciding factor is the last minute actually, because only when you go and interview or you talk to people who are actually going to teach you and put you into rotations, you know how you like work with them, because that is going to be very helpful for you. During that process is when I changed my mind. I felt more at home at Case Western, and more at more like something that was with my personality. I'm also a very logical person, technical person. So I wanted something where my base was strong, and at the same time they were able to like coach me through like helping people who are, you know, who who need me, I guess, again to say that, because Cleveland was also a place where it was multicultural, I want to say, because it had Cleveland Clinic, which was, you know, world renowned. So people from, you know, Dubai, princes of Dubai used to come for treatment, and they would come for, say, like consumer based testing, or like what they called this was like prestige testing, where they do genetic testing just to figure out if they're healthy or they will be healthy. And then they also had Metro Health, which was like a public sector where like the low income population. And Cleveland is the one of the oldest cities in the US, so they had people who were racially diverse. They had a huge African American Black community. That aspect, as well as, you know, at the other end, princes of Dubai coming in as well. So I had that diversity. So that kind of was my deciding factor. What kind of experience I will have at the end of it. I wanted that diversity, and I myself was a diversity to go into a GC program in the US to start off with. So that was ultimately it, the feeling of, you know, being that this is it, this is the right fit for me.
Great. Like, yeah, listening to your experience, like right from princess from Dubai to a low income group. Yeah, that's the right kind of diversity. And yeah, I think a program like this would really prepare you for all
Yeah.
sorts of patients out there,
Yeah.
possible out there. Um, you also mentioned that uh, the clinical rotations, having like these all in different areas. So, how do clinical rotations in those programs work? Like, what is the role of a student during the clinical rotations there in the US?
So each program is a little different, right? The program that I had, Case Western, and that has also changed over the years, that much I know. How it was structured was the first year was completely observations, and it would limit all the way up until pedigree taking, right? On the first years. So you get a flavor of what it is, how people are functioning, how, you know, counseling sessions are structured, how each counselor interacts with the patient. The second year was completely, you know, they expect you to work on the job. The good thing is that you have a senior GC or your supervisor supporting you through it. Um, so every rotation was 8 weeks long for me, and it would start slow, and then it will pick up pace, and you will start being involved in, you know, different areas of the ACMG or ABGC requirements. I'm not sure if that is available online. You'll be able to see each section. You'll need to fill at least one to qualify for a case. So your supervisors usually, you know, ask you in the beginning of the session, which areas do you want to focus on? Is it like history intakes, or do you want to do the actual core counseling, or do you want to be part of like research and trying to figure out support groups for your patients so that you get the diversity? It would start off like try at least one in each section, or like towards the end you're just like doing everything. You're basically a counselor with just someone watching over you. So it was full hands on by the second year. Like we that was all I was doing, counseling patients by the second year. And the clinical rotations were pretty intense, because we would be working a full-time job, pretty much be in clinics every day, as well as take classes. So, whenever classes were there, we would take classes, exams, so on and so forth. So student involvement was pretty much appreciated, and all the counselors there were pretty open to having a GC there. And it was always one-on-one. So there was no fighting, fighting for cases. No, there was fighting for cases, but we respected each other, and like, there was always a fight for the interesting case and all of that. But we took turns, but we had a one-on-one session. It was never shared.
Great. It really sounds like a very hands-on training where you like learn through your experience along with like classroom training. I asked that question because in India the clinical rotations are usually mainstream. You don't really have to narrow down for your clinical rotation. Like you can see clinical as well as cases where there is a genetic suspicion. So you see a mix of both. Uh, so one other thing that is different here is that you, as a GC, when you're getting trained in the program here in India, you don't have to pick a specialty. Whereas in US, we have seen a lot of people pick up like reproductive or inherited, or they go into certain niches like ocular or renal. So did you pick any specialty, and what was your motivation behind going in that specialty?
You mean after my training or
Yes,
during?
after your training.
After my training, okay. After my training, I had the basic information. I don't think it was as diverse as it is now, even just a few years back. Even I only have the option of prenatal cancer and inherited, and maybe, reproductive, yes, but not really. Um, but very niche was like not even an option for me, I guess, like because it was too new for people. Um, yeah, sorry, one second. Um, so I honestly did not make up my mind, and I was okay with it. I did not make up my mind. Again, a process of elimination. I knew what I did not want to do immediately after school. I did not want to have a primary in pediatric. I enjoyed more of cancer and like prenatal, just because it kind of made sense to me. It just came naturally to me in cancer and prenatal, and I kind of saw a similarity with those, just because not by the type of patients, but the style of working in prenatal and cancer. You could work independently. You could be an independent counselor. You were the primary point of contact in that room. Although I liked and I enjoyed working as a team in a pediatric setting, um, in a prenatal and cancer setting, you could work with other specialties. You could work with oncologists, you could work with radiologists, you could work with surgeons, so on and so forth, in like a cancer setting, right? The same with the prenatal setting. You work with perinatologists or BGYNs, you become training, you work with nurses. So it's like an all-round thing, right? It's like a continuous management then and there while you're there. So I enjoyed that. So I kind of, when I was looking for my first job, I limited it to prenatal and cancer because of that reason. And the patients there were also that way. Pediatric patients, your patients are actually the parents, right? And they come in with a different mindset, different attitude. They want to like, they come in with a thing of like, I want to fix it. Tell me what to do, right? In a cancer setting, it's not that. They have come to term with their diagnosis of cancer. They want to do this for other causes. They have children, or they have other family members, or for something that can help more than just themselves. They come in with that understanding, and the same with the prenatals as well. So I kind of liked that. I liked and I enjoyed, and I was able to see that aspect of it.
Great. I'm liking this like process of elimination which you've used in
It worked for me. I'm not sure how it works for other people, but
no, I can tell you it worked for the best after working with you. Uh, so now coming to like what you're doing now, you moved to India, you worked in the US for some time, you moved to India. So professionally, what are the few differences that you see here, and how is your experience like comparison to the US?
my answers have been long so far. This answer is going to be extremely long if I don't limit myself.
All
There,
US split.
there is significant differences. Starting from what is expected of you as a genetic counselor to how what I do from a day to day, right? There I used to be a clinical genetic counselor. So every day I would see 5 patients, write notes for 5 patients, and that was my day, right? And I would maybe once in a while I'll be called to lecture, like in the medical school, do lectures for like first year medical students who need basics of genetics, so on and so forth. um, I felt like I had time more for my patients, trying to find resources, trying to get them connected with other patients, talking to them about their feelings. And it was a lot more satisfying in terms of like the clinical practice. Here in India, not to say that there is not scope for clinical practice, because I think even in the last 2 years since I've been here, that scope has grown, right? But as a lab GC now, right, that was a complete 180 for me. Like, sitting in the lab, making sure samples are processing. So there's a sample, and I don't know the story behind it. Sometimes it feels like, unless I dig. So I have to find time to find that story and find what it is. So I kind of, you know, um, work behind the scenes, and it feels like I'm working behind the scenes. So, one second. Yeah, so it's fun in its own way, but I am noticing the differences, and um, in the Indian setting as well, I am noticing that you have to prove yourself. Like, it's what I took for granted. I have to prove myself here. Like, I know my subject. This is what I'm here to talk to you about. Although it's limited, I know my subject, right? So when you're talking to clinicians, you kind of like, you have to go in with that confidence, and you have to have that confidence because you need to know your subject to back it up. And that has been the biggest difference. What came to me, now I have to go after, is the biggest, I want to say, um, challenge as well as difference.
Yes, I can agree that okay, we are seeing a growth in clinical practice in India. Like you said, we as laboratory genetic counselors or genetic counselors who work with laboratory here in India have to deal with samples as well, and it's not just like we counsel patients and our job is done. There's a lot of other duties that come in. So, how do you, like you said, there is some change you're seeing. So, what difference do you think in training should be there when you're training as a GC in the US? What difference do you see? Like, okay, there are certain modifications you required in your training when you're dealing with Indian patients, and how did you deal with them, or how did you make those changes?
So you mean like, how did I make the changes, or
Yes, how did you adapt to the setting here in India?
adapt to the setting here? That adaptation, I think, came easily because I was in the lab now. I'm in the lab, right? I don't have to like day in and day out deal with patient cultural challenges, but there was a culture shock. I did go through a process of like, why are they not doing it here? What about HIPAA? What about like patient confidentiality? I think the first case I counseled as soon as I came back was a cancer case. She had some variant of uncertain significance in some gene, I don't remember, maybe even BRCA. So that's why I felt it was like, it's BRCA, right? You, even if it's a VUS, listen to me, right? She was just walking back from her an appointment, maybe a radiology appointment or something. She was on the road, she had her headphones, and she was walking and she was talking and she was insisting, no, I really want to, no, I listen to this now, right? And at that point I did not know. Culturally I was like blank. I did not know if I should say, no, I will not see you now, like, I can we come back, talk about it later? Because I knew that getting patients to that point was already difficult, right, in our setting. So like, so that was a shock to me. I was like panicked just by the fact that she was walking during our counseling appointment, and she was on an Indian road in, I think, in Mumbai. On the road there were honks and horns and vehicle noises. So I did not do well in that session. So like, it was just quite challenging for me to say no. We will not do this now. But she was all ears. She asked questions and this and that. So I still don't know if I did it right or what I should have done differently. But yeah, there was a transition process. The other thing mostly in cancer, and I think Mayuresh and I, we've talked about this quite a lot, is that your patient is not really your patient. Like, it's more, right? You have people behind that. It's probably the husband who is your primary person, and you have to like blurt out all the information because that man is asking you all that information. And when do you say no? Like, and then they say that, oh, my wife doesn't even know cancer, please don't use the word cancer. Or you know just how do you walk around that subject? Because I'm not used to it. I've always dealt with patients directly, and even if it is a terminal stage, they have come to acceptance. And here to say, can you like lie and say it's just an infection? That kind of was challenging. So all of those were cultural differences that I'm still learning. I'm not saying I'm not over them, but still learning every day. I think I have um, you know put my foot through the line, saying, this is how I will function, right? And I think that is something that in schools over here will have to work together, not separately on our own, but together, and find out where that line is. Like, as okay, allied health sciences, allied medical professionals, where we start saying that this is also important. Genetic medicine is going to be your future, right? And we are going to be your support system through that. So treat us like professionals, right? Just like how other other health professionals are being treated, drawing that line in schools itself, rather than saying you are genetic counselors and genetic counseling is one subject, right? I'm sure that there are very few universities right now, and correct me if I'm wrong, there are very few universities in India that are taking genetic counseling as their primary, right? And even in that, how much of counseling is happening compared to how much genetics? You might be more knowledgeable about genetics at the end of it, but how about presenting that information, delivering the genetic information in a counseling aspect, right? And structuring your sessions. And I keep talking about this because you need some structure to your counseling session to even deliver that genetic information. So I think that is where we start, and we add like what we will need in the future. So we start working on that, drawing those lines. What is the expectation of a genetic counseling session? Right? You will not go to a doctor's appointment and work on your laptop at the same time over there when you're meeting with a doctor. So please don't expect that over here. Maybe it's too much for me to ask, but at least setting those boundaries, setting our stage, dress for your profession, similar to that, like, dress up your profession in a way that you want to be seen.
Yes, I completely agree with the points you made. Like in India, the basic awareness regarding uh, genetic counseling is very less. Forget about patients; it is very less among the clinicians also, like
Yeah.
who refer patients. Like when you said that the patient was jogging or something, because there's also big role that clinician, while referring, might have said, okay, this is the test you need to get done. And a lot of patients are under the impression that, okay, this is some test which I have to get done, get the result, and it's over. And like you rightly said, as genetic professionals, we know there are a lot of things behind a single report. There are a lot of people who might be included. Like, take example BRCA or a cancer case. You know that it's going to have implications on family members as well who might be there. And like for a lot of patients, they don't know this when they come to us.
Right.
And in a society like ours, like in India, patients generally don't talk about their emotions. They are not used to talking about their emotions in a doctor's clinic, so they see us also as some doctor that,
Hmm.
okay, we've been referred. So like you correctly mentioned that there is a lot of awareness and groundwork we need to do in our patients with our clinicians before we like say that, okay, we are going to have like genetic counseling. And you rightly mentioned that there were a few programs that focus on genetic counseling solely. They might have 1 year or 2 year uh, focus on genetic counseling, but not dedicated programs as such. And yes, it is very different for our society and Indian patients altogether who are like very new to like talking about feelings or uh, talking about, okay, what they're going through with the disease. So yes. Um, so with all this going on professionally, you're dealing with all this for 8 9 hours. You're working in clinic. So my next question is, how do you deal with the burnout that might come with it, or how do you unwind with the stress or the things that you're going through in your professional life?
Uh, I think you know, like we get on phone calls and we're just like talking for multiple minutes, I want to say, because we don't have time as much. But I think you need a support system. Sorry. Um, you need a support system, and I'm very fortunate with us, right? Our team of genetic counselors, your groups like these, where you just bounce off ideas. Because I feel like even if I talk to my family or friends who are in the medical profession, they don't really understand why I'm getting mad that a patient did not find it helpful, or like did not talk about their feelings. They didn't open up. They were kind of closed off. I don't think they understand what I'm trying to say. So I think you need support system, people who resonate with you, but at the same time you need to know where to draw that line. I think we kind of go off sometimes, and this is human tendency when we have a listening ear, just like right now, and I'm talking and I'm happy that you guys are listening to me. The same thing we do, right? Like when we are whining, when we are complaining, or when we are trying to express our frustrations, we kind of talk. But then it's like taking that step further and like, okay, let's put this aside, let's go do something else, right? You need that. This is going to be your day in and day out, right? Until like in some point in your life you are making those changes for your profession, it is going to be a challenge, and we are going to continue to do it. We're not going to back off. We're not people like that as genetic counselors, right? But to find something else, for me, it's working out in the gym, right? I go to the gym almost every day, and I make it a point. And I have people like I work with, and Manaswini is here, so she'll tell you. Both of us have timers that'll keep ringing. There'll be alarm clocks like asking us to like get up and leave, and we will still be working. And then she'll remind me it's 5:30 or it's 6, aren't you going to your gym? So people like that who will push me to do something else as well, right? So gym is a place that I try to like break out, like do something different, completely switch, right? I go there and I lift weights. I meet friends, and then the main reason I do that is mental health, right? While you're lifting weights, when you're like doing something, you're focusing on something else other than your work, and you want to improve on that, so you've got something else, as you see as growth. So it might be anything for you. It might be that you have another business on the side, or this group for you guys that you're trying to build and grow. So something that completely takes your mind off of this, um, would be, I think, a good way. Not saying I'm perfect at this, because I'm not. I still, like, after I finish gym, I'll come back to this. I sometimes do. And we'll keep working on it. It's just, I think the most important point is recognizing when it starts getting to you, right? And it might come in different ways. I feel like for me right now, like, there's going to be burnout either way, right? And you need to know how to recognize it. For me right now, it's more of like, I push myself into work. Like, I take on things. I do not know how to say no. I'll say no, I have to do this, I have to prove myself. I feel like that is the point where I'm going, right? And that is going to one day lead to a burnout, right? And it's not like an end stage, it's a process. So it's better that I start recognizing it now and start saying no to things, drawing those lines, and learning how to deflect it so that I make time for that, the other thing, like a gym, where I'm not thinking about it, right? So I'm still learning. I'm still learning with my colleagues here, trying to see, I'm away. I'm not here right now. You know, make sure I get to the gym, things like that. Yeah.
Yes, I can totally attest to that. Nivedita is like, yeah, I can imagine totally. With genetic counselors, very what do you say? We don't cannot say no easily also, and like you
Yeah.
said, in that space, sometimes our work gets like to
Yeah.
us,
Yeah.
and
It's a professional hazard. I don't know how, but you've got to learn. And if someone knows, let me know. How do you say no
yeah,
when a task comes your way?
especially in our case, our team needs to say no.
I'm trying. I'm trying.
That I am just so happy to hear that all of us collectively have the same thing, that we can't say no and we just don't know how to say no.
Yeah.
Yes.
Yeah. How do you politely say no, right? Like, I've been watching, this is the other thing I like doing. I like watching TED Talks and like communication videos. And recently, um, I've been listening to this podcast. It's called mm, Act Smart, Talk Smart, or something along those lines. Where it's Stanford's communication school putting on this podcast on how to, like, communicate, and there are multiple different things, and I find a lot of parallels to our profession, like how you communicate in professional settings. How do you talk about empathy? How do you talk to, a big group of people or a small group of people? How do you make sure you have your audience engaged, right? Like, your audience is your patients. You've got two people, that's okay, but how do you keep them engaged, right? How do you not have them stray away to the thought that, I fed my child this, I fed my child that, and they threw up? That's irrelevant to our genetic situation. So how do you keep them engaged? So I'm liking it. And one of these things, like, I try practicing them during sessions or something. And I am trying to politely say no, saying, there are some videos that are like, you take it in, and then you say, this is how much I can work, right? I understand that these are your needs, but this is the limitations of my time, this is my bandwidth, this is the extent to which I can expand. If you'd like to take this away from me, I would do it. So it's like a tactic where you throw other things, make it difficult for them. I don't know. That's how I see it. Make it challenging for them and see how much you are doing, and ask them to take one task so you can work on that. So you're not really saying no. You're saying, find me the time, help me make that time so I can work on this. So those are some things that,
That's a really nice approach. Like you work as a team, like okay, you do this, I do this.
yeah, yeah,
And yeah, I think we all are going to go through that resource and to see
yeah,
what it has in store for our
yeah,
communication.
yeah. It's fun.
So I think after like seeing you for 2 years working here with you, uh, I also kind of know what is your motivation behind pursuing the PhD you're doing in public health. So how did that happen, and what is like if you're working public health, it's like a very another niche in India.
Yeah.
well researched in like infectious diseases or cancer maybe.
Hmm.
But in terms of genetics and genetic testing, it is still a big niche, and you're
Hmm.
pursuing a PhD in it. So, um, what is your motivation behind that, and how are you going ahead with it?
Sorry, my phone is ringing. This is the other thing that happens in an Indian setting. That's my work phone, and it's ringing and stopped. But uh, yeah, so the PhD, it kind of happened. I honestly don't know. It was in my plan. It is in my books, right? It was supposed to happen maybe in 10 years from now, but then it happened now. And this is how it happens for me. Like when I'm like all in and more sometimes. I did my dual masters while I was doing MS in genetic counseling. I took on MA in bioethics, and at the same time, right? And that itself was challenging because I was in my second year and I was doing another degree. The same way, I think I've gotten myself into another similar situation here. But the main motivation factor was that genetic counseling and public health are going to come together. They have to in the future, because look at where we are, and this is what I want to focus on with my PhD project, and this is what I am working on. The just general population. India is such a diverse population. You've got so much pathology here, and you have got so much genetic background, especially in the south when there's consanguinity, increased chances of inborn errors of metabolism. But we don't have a program that can screen babies for those inborn errors of metabolism. And there are so many families just within the 2 years, with the limited clinical exposure that I have in within the lab, that I've seen so many families with multiple babies who've passed away by mysterious metabolic conditions and they've not yet been diagnosed, right? How have they gone this far after having 3 4 babies that they don't know a diagnosis, right? How is it that they're pregnant again and suddenly it's another emergency, right? So there are so many things like that in our settings, that there needs to be education. And I know genetic counseling in itself is an education field, right? We are trying to educate our people. But I think it doesn't just start with, I can't go up to a person on the road and say, I'm going to educate you about genetics. I've got to go higher, right? I've got to go to a place where there are more important, stronger people who can listen to me. And for them to listen to me, I need a better degree. I just felt that. I felt like they're not going to listen to someone with an MS in genetic counseling, even though it is from the US. That was not cutting it for me, right? Like, and I just tried going and speaking to people, and it was not enough. So, like, where else can we go? Where else can we be used as public policy makers? And how else can we be utilized? And the only way I saw here was to get a PhD. And I did not want to do a PhD in genetics. I wanted to do something that would one day change, and I hope one day it will change how genetics is in public, right? We're not just doing it for the people who are most, who make the most money, right? Genetic testing is expensive, but how do we make it more accessible to people who are general public, who are those people who have had multiple babies who pass away? So yeah, I don't know, we'll see.
That's amazing. All the best for your PhD because, like you said, like educating and bringing that awareness regarding genetic testing, genetic condition, and undiagnosed
Mm.
causes running around in families is such a big issue in India. Like,
Yes.
I think we have seen, I think genetic counselors here who are practicing might will agree that in India we have this families coming in very often that they have like history wherein they have lost like so many
Mm.
pregnancies, but they still don't know what went wrong,
Yes.
and nobody even referred them for a genetic testing or a genetic counseling session. We just carried on, and without. So I hope your study brings that change that people
Yeah, I
start
hope so.
noticing. At least people who come in contact with the study, they start doing it. and some family gets benefited out of that.
Yes, I hope so too. Hopefully, more than a few families.
So to like we are towards the end. So what message would you like to give to our practicing genetic counselors and students on board?
Um, well, one thing, we're all here majorly to. I'm hoping this is how I'm observing this. We're all here to help people, right? We're not here just because genetic counseling is a cool field. Yes, it's a cool field, but we need to. The ultimate point is that we're here to help people, right? We're here to help them, and we are here and we are humbled in our position that we are able to give them that information, right? And we are here to work together as a team for the better of, like, genetic medicine in the future. um, I just hope that you all come in with a genuine, background. You are here lifelong learners, and you are lifelong learners throughout, right? And it's very difficult with the hustle and bustle and the fighting that we are doing to get our field up and there, that we don't lose track of what we are actually here to do, which is, finally to help people, and in our way, as much as possible. Because you can have a genetic counseling session in 10 minutes, you can have a video, but that personal touch, being there for your patient and understanding what type of issues that they bring in, right? Their challenges that they bring in. Have a listening ear. Do not get pushed around by the hustle and bustle and like the demands of this field in India, because there are a lot of demands for the field of genetic counseling, which might not involve the counseling aspect and it might take it away. So just being mindful of that and being mindful of what you really want to do. So that is what a little bit of advice.
That's a really cool advice for me. At least I am going to implement it, like to say and see what you want to do as a genetic counselor. Thank you so much for sharing that. So now we will be opening the platform for people here online to ask questions to you. So if anyone has questions, feel free to unmute yourself and ask your question. Or even if you have any feedback, you can unmute yourself and give the feedback.
Yeah, so good evening, Irish. Good evening, ma'am. Good evening, everyone.
Hi.
Hi. I wanted to ask, the whole session was really helpful. I am a student studying MSc in VIT Vellore. So for me to get information of all this in advance, it feels like I'm getting. I think I'm getting something that I would have gotten few years later. So this information I think really helps me a lot. So my query here is, how do you see this? As you was talking about genetic medicines in public health, how do you see this field of research, or this field improving or moving ahead in 5 years in India or in the world as whole? Where do you see this field going? Where does it go? How are our professions affected by different things in this world? Like how do we see ourselves? Where do we see ourselves in the next few years? What is your opinion on that? Thank you.
um, and I'm very honest about this. I'm not hiding anything, but I really think we have a lot of scope. We our doors are wide open right now, because in India it's still very, very niche, right? It's very, very like, you're in the initial stages. You could do whatever, right? In the US they already have branches, genetic counselors who are in pediatrics, who are in cancer, who are in ophthalmology maybe, and there are public health genetic counselors. They've created what they need, right? Here in India, we're still discovering what we need, and I think there are avenues that we can create it for our own. And there's only an upward growth. We can't go backwards from here, because there's not much. We have started this, we have started moving forward, and there is a lot of growth. So I also see that we will also move away a little bit from the lab settings, as more people are getting trained in with, and especially if BGCI, right, if it becomes a really truly national level organization, and they recognize that this is it, and they have more genetic counselors with stringent criteria that we start putting together, we will start getting that respect, we will start creating those areas, we will start being pioneers, right? So I really am hopeful for the Indian scenario here. um, but for that we will start need to start communicating. At this point, while we are in our own things, we might be working for different labs, it is corporate and it is on its own a different play field. But that's what I was saying, we have to know what we are here for. Is it for helping people? Then let's do that, right? Let's think about corporate money a little bit later, but then like we do have to go and all in with like trying to come up with a field that is very ethical, very straightforward, very quality driven about the counseling aspect of it. I hope that helped. I don't know if I was
Yeah,
coming
yeah, it
along.
did. Thank you so much. Thank you.
Anyone else has questions?
Yeah, hi ma'am. Thank you for doing this with us. It's really been very helpful. I just had one question. So, like I've been watching a lot of interviews of US genetic counselors and Australian genetic counselors, and they put a lot of emphasis on reflective learning or reflective writing about their cases or about their behavior while conducting the counseling
Yeah.
session. Whereas in India this does not happen, and they have been doing it since their bachelor's or since their high school level. So how do you think that can be developed within the students? How can they start learning about reflective writing?
Reflective writing, reflective learning, is it?
Yeah.
That term is new, but I think the idea is
Yeah.
I think I know what it is, but correct me if I'm wrong. But here we are in a area where marks, right? We have marks out of 100. If you're comparing, you're comparing to the next person sitting next to you, right? He got 92 and I got 90. I've lost 2 marks. I don't think that is reflective. What is reflective is that you are your own competition, right? So you see that you become a lot self-critical with that, and that's also something that we have to keep working on. And it's okay if you're not making those drastic changes in one session to the next. And this was something, as a new genetic counselor, I think I got caught up in. I would come back from every session and I would do it like, what happened, what did I do wrong in that session? It was always like, what did I do wrong, right? It was never what did I do right, right? So I used to get caught up and it would make me feel down and this and that. And but then it also gave me space to grow, and it kind of helped because I was in a prenatal and cancer setting. There was not much variables there, right? It was always the same type of counseling. Family histories was similar, except that they were like differences in like age of onset, things like that. But then there was not that variables like in a pediatric setting. So it was easy for me to go and reflect. After one point, it became truly skill based development, right? I was taking feedback from patients, kind of like seeing how it went, changed up the counseling style, changed up the way I phrase sentences, things like that. And with the next session I would try implementing it, right? But I think what I tripped up on was that I expected to see change every session. I wanted to feel good, I wanted to feel better that I did it. But I don't know, maybe another thing about genetic counselors and our personalities, we are never happy people with our skills. We want to keep doing better, we want to keep doing better and doing things. Um, so yeah, I would say it is a good way, but then keep long gaps in between. right? If you want to write down, one day you're feeling very good about yourself, write down what it is. One day when you're feeling very bad about how it happened, write it down, put it aside, put it aside for like a month, maybe even 2 months. Then again, you would do the same, right? You would write down things and you just compare and see like you have grown, and that's a motivation. um, so I think that also you have written evidence, documentation that you have grown, and you can show that to people. uh, like if you're thinking about schools and programs, you know, showing a seriousness for your skill development.
Thank you. Yeah. Like I think it's really important because, you know, as counselors, you guys might be having cases that is filled with so much, you know, I won't say negative emotions, but emotions that are on a heavier side. And
Yeah.
for you to process it and to translate it to the person and process their emotions as well, it becomes twice the work. So
Yeah. Yeah.
another follow-up question would be like, how do you manage those emotions when it comes up?
How do you manage those emotions? um okay, this is something that you will learn to do on your own, and it does come with time, so I don't expect things to be learned overnight with this. um, I mean, you have to feel natural about it, right? If you are happy for a patient when you're giving a negative report, it's because you like giving negative reports, and it makes the patient happy, you are satisfying them, it's what they wanted to hear. But at the same time, if it is bad news and you know it's a bad news, just go lean into that emotion. Say, unfortunately, I am bringing bad news to you, or like, I am unfortunately, might not be something that you wanted to hear today. Like, lean into that and like, kind of be natural with it. Your response has to be very natural, not, structured at that point, not scripted. And you go in with the flow, and kind of debrief after if it is challenging for you. There have been challenging cases for me, and it just goes off in your mind, and it's very difficult, it's very sad, right? The cases sometimes that we see. But at the end of the day, there's only so much you can do. You cannot take away a genetic diagnosis, you cannot change something for them. So you've got to lean into it, accept it, and be there for your patients, because it's not you exactly going through it. So if you're starting to feel very, very strongly, then you do have to take a step back. You have to hand over that case to someone else, because if it's roping you in like that, recognize where your limitations are. So yeah, it comes with practice, not something. Yeah.
Thank you so much for answering and clearing my doubts.
Any other questions?
Any other questions? I think we are well above our time as well. So I'd like to thank Nivedita. Thank you for doing this with us and
Thank
sharing
you.
your journey with us.
Thank
I'm
you.
sure I'm sure everyone in the audience is going to take back like good parts which they can work on and good message from you. Like how you deal with burnout to how your experience was to like what you said about reflective writing and learning. I'm sure that's very interesting because yes, that is very important for us GCs. And like you said, GCs are kind of like perfectionists. We're never happy
Yeah.
with our work. We're like, okay, we can do this, we can do that. I
Yeah.
think our daily phone calls are like an attestation to that. Yes, we need to do this, we need to do that. But yes, thank you for sharing your story. I'm sure people will resonate with your experiences, and we will have good prospective students coming in and motivated students. So thank you for doing this with us. Have a
Thank
love,
you.
have a lovely evening and a nice weekend.
Yeah. Have a good evening, guys. Thank you for having me.
Thank you.
Thanks.